Good morning. I'm just such a soft voice today, sorry. So I would like to introduce Ashley Miller. She is the program director, right, at Seacoast Family Promise. There were questions earlier about whether or not diapers would be welcome, and I'm going to let Ashley kind of give you a short rundown, but yes.
I'm good at that. We'll be good. So yes, absolutely, we will always take diapers. Right now, our biggest need is for the larger sizes, though. We're all set on little oogie boogie sizes, but pull-ups and like 5s and 6s are always welcome. That, in addition to the list that I know that Judy already shared, laundry soap is one of our biggest needs right now, and then general household cleaning supplies, of course. All right, well, let's get started then. Thank you so much, Judy, and thank you all so much for coming today. Like you said, my name is Ashley Miller, and we actually just updated my title, so I am now the Director of Family and Community Services. Thank you so much for coming, and I'm really looking forward to talking with all of you about homelessness and housing, especially knowing that you guys made such a generous contribution to us earlier this year that has come in handy beyond what you could even imagine this year. So thank you so much. We'll talk a little bit about that too, so you guys have a couple of updates and stories on those sort of things. As most of you know, this is a two-part series. Today we're going to talk about defining homelessness in our community and beyond. And then in 2 weeks, we'll follow it up with some resources and tools and how you guys can help. So today we're going to be talking a little bit more about understanding what family homelessness is, what some of the causes and demographics of family homelessness are within our community and throughout New Hampshire, and then also talking about some challenging myths and misconceptions that exist about homelessness, especially family homelessness. So a little bit about myself. I just like to let you guys get to know me a tad bit. I have been working in homelessness and housing for over a decade now, working in the nonprofit sector for about 15 years. And I have a myriad of experience working with homeless youth, foster and adoptive care, clinical work, and I'm rooted in social work. So I'm a social worker by trade. And then I've been with Seacoast Family Promise for 10 years now. 10 years in September, actually, which is really exciting. So I have a big passion for ensuring that vulnerable populations are receiving services and have the opportunity to speak openly and have their needs addressed in ways that are appropriate for what they're going through. So, what is homelessness? It looks a lot different on a TV screen or sometimes reading in a book than what it actually is. Logistically, we have this sector called HUD, that is the federal government, that's the Department of Housing and Urban Development, and they break homelessness down into 4 categories. You will learn quickly that these 4 categories do not cut it when it comes to helping families. But generally, the 4 categories are literally homeless, at imminent risk of becoming homeless, homeless under other federal statutes, and fleeing or attempting to flee domestic violence or intimate partnered violence. When it comes to literally homeless, this is the one that really speaks for itself. This is somebody who's on the streets or in their car. They're in a place that's not meant for habitation. So anywhere that you see in a movie where somebody's like sleeping under a overpass or those types of things, that's this category. And this is where a lot of single individuals exist categorically when it comes to homelessness. Imminent risk, again, kind of speaks for itself, but there's a couple of things in here. So if you have a lease that's coming up in 14 days and you have no way of securing stable housing past that date, or you've been in an institution for the past 60 to 90 days and you don't have an exit plan at that point, so that's hospital discharge, prison, or another shelter or housing program. If you don't have a plan at exit to go somewhere that's going to be permanent and stable, you're in that category as well. This is the most confusing one because it really doesn't say much, but the best example of this is unaccompanied youth. And the reason why we have this category is they get different monies, really my best way of explaining it. So individuals that are unaccompanied, so if you're under 18 and you don't have another adult with you and you're experiencing homelessness, any of those other descriptors that we just talked about, you fit into this category. And they have their own category because a lot of times they're funneled in from other different sectors too. And again, sometimes other people fit into this, including those coming from a hospital discharge or inpatient facilities. But it's kind of a catch-all for the rest of those. And then lastly, like I said, is individuals fleeing or attempting to flee intimate partner violence or cases of domestic violence. Again, speaks somewhat for itself. You're experiencing intimate partner violence, and that could be anybody in the household. It could be a mother, a father, a single individual, it could be a child, and then they would be plopped into that other category as well. So you can exist in two, but that's what this one is. That works good, trying to drink out of the microphone, right? So when push comes to shove in New Hampshire, so we have the New Hampshire Coalition to End Homelessness. A lot of the numbers that you're going to see today, I pull from this. When we look at homelessness as a whole and legislatively, we're talking about these three things. If an individual or a family meets one of these categories, which is somebody who does not have a primary nighttime residence that is, or somebody that has, a primary nighttime residence that is just a public or a private place that's not intended for habitation, so sleeping on the street, sleeping in an abandoned building, those sort of things. Secondly, somebody living in a publicly or privately operated shelter, Seacoast Family Promise. And thirdly, somebody who is exiting an institution, shelter, or inpatient facility. And those are generally the three categories that the state of New Hampshire uses. Yeah?
Real quick question, did I miss, or how about people who are staying with family members on a temporary basis? So they're in a place that's meant for habitation, but...
There we go.
All right.
So, who's missing? There's a lot of folks that end up missing when we look at homelessness as a category. And more often than not, families fit to this. So, exactly what you said, folks that are temporarily staying or on a semi-permanent basis with friends and family, those folks that are couch surfing, so going, yep, exactly, from couch to couch or bed to bed. And then also in New Hampshire, what is super common is winter rentals and campgrounds. We've got a lovely system set up where in the wintertime, all of the beach rentals are super affordable. And during the summer, we have campgrounds galore. So we have a lot of families that go back and forth. So rather than going to a shelter, or if staying with a friend or family is not an option, they hover back and forth and they'll go from winter rentals to campgrounds because it's far more affordable than any housing in the state, which is what we will also talk about. So yes, this is who is missing. And subsequently, this is where families fit in most of the time. The reason why this is titled The Hidden is because family homelessness is not seen as readily as single individuals who you may be able to see visually sitting on a bench or outside in a campground and those sort of things. Families are usually in one of these categories, so we're not visually seeing that it's happening. However, in towns like Exeter, let's use that one because that's where we're located. It has one of the highest rates of homelessness, family homelessness in the state. And we don't see it at all because they're couch surfing, they're in the campgrounds, and there's a number of trailer parks that are kind of tucked back away from downtown and everything. And the number of doubled up families in those units is unbelievable. We don't have an actual number on it because they don't report it, but as being somebody who's been working in homelessness and housing for 10 years and knowing a lot of those individuals, I can speak to it, the fact that it is rampant in those areas. Yes. Yep. Yeah, so she just asked about hotels. Hotels is often plopped into temporary shelter. Right now, the federal administration has claimed it as a solution in a lot of places in the country. It is not. It is not a permanent or reliable place of residence. It is actually used as emergency shelter in New Hampshire. And we'll talk more about that too in session two, when folks, families specifically, are experiencing homelessness and they don't have access to shelter or shelter bed. One of the resources that they have is to go to the welfare departments and get financial assistance to stay in a hotel. But that runs out fast. And you also have to have used up every penny to your name before they will help you, which is just this awful cyclical process. Yeah. So when we talk about families in the state of New Hampshire, we do this fun little thing called the point in time count every single year, every January. And throughout the year, we keep track of it as well. And consistently, family homelessness has continued to grow in numbers year over year, unfortunately. We've done an incredible job at tackling veteran homelessness in the state, and there's so many resources at hand. I could house just about any veteran you send my way. But unfortunately, family homelessness is not quite as easy. And when looking at our most recent point in time from 2023, we saw that on any given night there was about 2,335 families experiencing homelessness. And if you look at this lovely map over here, I'm going to come over this way. This giant blue area, so almost everything, is financially what Seacoast Family Promise is a part of. These other two little tiny areas, the Manchester COC and Greater Nashua CC, are the other two. So financially, monies in the state, when you receive financial assistance, they also has a little asterisk next to this for Concord, but it gets split up by these three, kind of four areas. So there's a huge disparity in funding. Mind you, there's more resources in Manchester and Nashua than there is in some of the state, but homelessness up in the upper counties of New Hampshire is a never-ending battle, and they get little to no funding because they're just a part of this giant catchment, and we're expected to spread the wealth, which is incredibly difficult. So just a unfortunate picture of funding in the state and why it is challenging in this area.
Who are the other two agencies that you mentioned that receive funding as well as Seacoast Family Promise?
Oh, I think I mentioned, did I mention a domestic violence one? Is that one of them? There's, all of the shelters, really, in New Hampshire are eligible to apply for state funding. Oh, the other two I said, those are just areas of the state. So balance of the state speaks for itself. It's anybody who's not Greater Nashua, so all Nashua and then the neighboring towns, and then Greater Manchester, which is Manchester and all the neighboring towns. And then again, there's like a little acceptance to that when it comes to Concord. There's a lot more resources and agencies that sit in there, so they just get a little bit more for those reasons. But yes, thank you. So let's move on to causes and contributing factors for homelessness among families. We're gonna take a peek at three different areas. The most significant one being economic stability and the rising housing cost, which even if you have not personally experienced homelessness, I'm sure you are completely aware of how expensive it is to live in New Hampshire and just how expensive it is to live in Rockingham County. So, when looking at the median rents in the state of New Hampshire and the cost of housing and the availability of it across the state, currently as we stand, in order to meet the need of housing for families and for the state, New Hampshire would need to create more than 23,000 housing units to meet the need that we have for housing right now. And by 2040, we would need to create 90,000 or more housing units just to meet the need at the pace that we're currently at. As we know, that increases, and of course, expenses keep going up for utilities and all of those things. So that's just currently, it's likely going to get worse. Yeah.
Not just residents, but people who come in and out.
Correct. So this is not just to meet the need of homelessness either. This is like the whole state. So this isn't even talking about affordable units. This is just how much we need to meet the need for humans in the state of New Hampshire. And likewise, if we look at the state as opposed to what is like its standard ideal practice, the state of New Hampshire has hovered under a 1% vacancy rate for the past 4 or 5 years. Yeah, at least 5 years, going back further. When ideally, you should be having a vacancy rate of about 5 to 8%. So we're less than 1, which is why it's such a discrepancy when it comes to available units for individuals and families. Along those lines, if we look at how much it costs to rent one of these units, and for all intent purposes, we're going to talk about 2-bedroom units, because that's what we do most of our statistics on. So anytime I'm referring to a unit, I'm often talking about a 2-bedroom unit. My caveat with that is the number of individuals in my shelter that only need a 2-bedroom unit is this big. We need 3 bedrooms, 4 bedrooms, 5 bedrooms often. And we don't even get to talk about that when we look at the numbers in the state, because they're almost non-existent. So when looking at a 2-bedroom unit in the state of New Hampshire, the average cost is around $1,600 to $1,800 a month to rent one of those units. And over the course of 2019 to 2023, that cost has regularly increased by about 36%. And then if we look at Rockingham County, which is our primary catchment area at Seacoast Family Promise, we also service Stratford County, Stratford County, and then some of the bordering Maine and Massachusetts towns. But primarily, we service Rockingham County, and their area median rent is $2,069 a month for a 2-bedroom unit. Without utilities, yes, without utilities. If you find something with utilities, whew, it's like a magic trick that you've done. And then if we look at those units and how much rent costs and the breakdown of families, affordability comes into play, which is absolutely the #1 leading issue when it comes to finding stable housing for families in New Hampshire, is affordability. Only about 13% of the housing units in New Hampshire fit into the category of what is considered affordable. And affordable, the ideal, is that it's about 30% of your household income. So if you're making $1,000 a month, that's $300. Tell me where you're going to find an apartment for $300 or $600, frankly. And 87% of them are far, far above that. In 2024, we took a look at the median renter household incomes in New Hampshire. And in New Hampshire, the actual area median renter, so the whole household, so this could be 1 income or 2 incomes, technically it could be 3, but the median is $56,814 annually. However, to afford a 2-bedroom apartment in the state of New Hampshire, you have to make a minimum in your household of $73,300. That's more than a $16,000 discrepancy, which is a whole other full-time job in a lot of cases when you look at what our minimum wage and what the availability is for jobs right now. So huge discrepancy, both just feeding off of one another, no availability, and then a lack of income and affordable housing for folks to move to. So in addition to the biggest cause of homelessness and housing insecurity in New Hampshire, especially for families, being housing insecurity, high rent costs, and not a livable wage. Are these three other categories, including domestic violence, which I touched on quickly. This is actually the leading cause of homelessness in New Hampshire for women, unfortunately. And then job loss, which kind of fits in with the other stuff we just talked about. Consistently, folks that are losing jobs or losing jobs that they've been in for a period of time where they've established a rank, so to speak, and so then when they leave and try to find another job, they're not able to match that income, so they're not being able to sustain the income that maybe they've had for years. We saw an unbelievable amount of this happen during COVID. One of our mothers, Jana, I will share her name because she's fine with that. She rents one of our affordable housing units that we own and manage next door to our facility, and she lost her job that she had been in. I think she had been working there for 7 years, and she was doing phones and desk management. And they cut her position completely when COVID happened. So she lost her job. She went to try and find an equivalent position, but because she had only ever worked there at that one place, didn't have any education in that field, they were only offering her about $17 an hour for something that she was making more than $28 previously. And unfortunately, she's not been able to find a place to be able to support her in that amount for a new job. Another very significant area is health crises, which encapsulates a lot, not just I'm sick, I'm out of work, I can't pay my bills. Within this is also folks that are on a fixed income. So we have a lot of individuals that we see that are coming as a single head of household family, so one parent or one guardian with children, that are on a fixed income, Social Security, and don't have any other resources for income. With those households, we know how much they make a month. We know they can't make any more because Social Security says they can't work. And in those cases, Social Security isn't enough to afford a 2-bedroom unit in the state of New Hampshire. Exacerbated by that, when your child turns 18, your benefits go down. And their income, if they're working a part-time job, goes towards your household income. That's probably, looking at the number of families in the past 2 months that have applied for assistance through Seacoast Family Promise, that's probably the number one situation, is that their kids have turned 18 and now they can't afford the rent because it's going towards their fixed rate income at a subsidized unit. And I mean it like skyrockets. Even if a kid's only working at a grocery store 35 hours a week, their rent is going up sometimes by $1,000 a month. And if you're on a fixed income as a single parent, that's not plausible. And even the child's income, they're still going to school, they're still doing all these other things. It just hasn't been manageable. So that's what we're seeing a pretty big increase in, is those families reaching out and asking for assistance from us right now. Financially, but also with like food and household goods, because they also don't qualify for food stamps because their children are too old. So yes, within this health crises category, there's kind of a lot stuck in there. We have seen families come to shelter with us who, one family in particular, mom got cancer, was out of work, and they were only on Medicaid, and the number of specialists and doctor's appointments that she went to, their medical bills far outweighed what they could ever afford, and they ended up in crippling debt, and they lost their home. They had a home. The dad was a middle management position, so they were getting by, but when mom lost her job due to illness, they couldn't make it anymore, and their home went into foreclosure. And that's a family that ended up at our doorstep and coming to shelter. So survived cancer, well, healthy, doing wonderfully, but did not survive the crippling medical debt that came along with it because they were already a low-income household. And then had to start from the ground up with a foreclosure on their record. So I'm going to chat a little bit about some myths and some misconceptions that we have about homelessness. I tend to talk very highly of all the families that I work with and all of the individuals that I'm interacting with when it comes to homelessness and housing. However, that is not generally how people perceive homelessness. There's a huge misconception that folks that are experiencing homelessness, and this isn't one of the things I'm going to talk about, but it's probably one of the top things people think of, is that they are substance users, and that they I do talk about criminal activity, but there's substance use issues and criminal activity, and that's why they're homeless. That's a very small number of individuals, especially when you're looking at family homelessness. When it comes to family homelessness, it could be any human sitting in this room. We just wouldn't know because it is such a hidden category of homelessness. But let's talk about some of those myths. So something I hear constantly, even coming out of the mouths of some of the families I work with, is that homeless people are lazy. Let me tell you, that is far from the truth. If anything, they're some of the hardest working individuals I have personally met in my life. When you look at somebody who's experiencing homelessness and what it requires of them to move to stable housing, they are working around the clock. So they have to not only do their regular day-to-day life things for their families and for their children, but they also have to apply for housing assistance, work towards attaining new jobs, or rewriting resumes, going to interviews, all those things. Sitting and working with service providers, one after another, who all ask the same exact questions and ask you to fill out the same exact paperwork, but you've got to do it time and time and time again. And then throw into that keeping up with applying for benefits, for food stamps, and cash assistance. And that process, if you forget one piece of documentation, they disqualify you for the benefits immediately. That's where we pop in and help folks, because we know it's a huge burden to bear, all of the things that it takes to move to stable housing. And with our case manager that we have, and myself, we work very closely with each family to ensure that they're getting the resources and tools and support to manage this process. So not only while they're in shelter do they have these resources and tools, because it's happening constantly in that setting, we also care for them after they've moved out of shelter, because most of this continues. So after they've exited out of shelter, they still need to reapply and do their redeterminations every 6 months, filling out Medicaid paperwork. Holy cow, that's just getting worse and worse. So they can come back to us and get continued assistance filling out those forms and getting assistance that way. Yeah, there it goes. All right, so another one, and this is probably one I've been having a lot of conversations about, so I'm excited to talk about this one a little bit. So there's a lot of folks that have a misconception that people experiencing homelessness that they see are homeless by choice. They think, couldn't they go to a shelter? Couldn't they stay in a hotel? Couldn't they stay with somebody else? And because you're visually seeing them on the street or hearing a story about somebody who's experiencing homelessness, why aren't they taking advantage of those things? I'd love if we could help every single person in the state of New Hampshire experiencing homelessness. Even if we did, there'd still be people who choose to be homeless because it's much safer for them than going to a shelter, which I know is kind of a taboo to say out loud, but it's true. We're fortunate that we are a family shelter. So we only service families with children under the age of 18. When they come to our shelter, that family stays intact. So they get their own bedroom with their own beds and dressers and everything. However, there are many shelters in New Hampshire, across the state, across the country. If you have a 16-year-old son and you're a single mother and you're in an emergency shelter, that son has to go to the men's dormitory. So you immediately get split up from your minor child. And that is horrifying for a parent. So in those cases, yes, they will choose not to go to shelter, because they'll say, this is the unit available for you, go take it. And they say, no, thank you. I'm not letting my son be in that room with all those other people that I don't know. Similarly, I talked quickly about veteran homelessness in the state of New Hampshire. A lot of folks that visually see homelessness in New Hampshire is when people are standing outside with a sign or have a hat on the ground with them. Very frequently, those are veterans. And I know, which is heartbreaking to hear. However, more often than not, that is the safer choice for them, to sleep on the street or sleep in a campground, than it is to sleep in a congregated shelter. There's this lovely thing called PTSD, where somebody can be incredibly triggered and traumatized by loud environments or open, crowded spaces. And if you put a veteran, especially a combat veteran, in those spaces, sometimes they, in turn, can be triggered and have violent outbursts and get barred from the resources. And a lot of homeless shelters also have food pantries, and if you're barred from the facility, then you have to leave. It goes on and on. So choosing to live outside in a space that you have more control of your own bodily autonomy, and sometimes in a group of other individuals experiencing homelessness, so some of those campgrounds that we see, that is the safer choice, and that's harm reduction. They're choosing to stay safe and be safe and ensure the safety of others in those situations. So when you see those folks and you think, come on, why aren't you getting help? Why aren't you taking those resources? Pause for a second and just think, maybe this is what is safest for them, because a lot of times it is. So, absolutely not necessarily a choice. As we talked about before, the lack of affordable housing, the lack of a livable wage, all contributing factors of becoming homeless, and is not the truth when it comes to families particularly. They're absolutely not choosing to be homeless. I'm not going to spend a whole lot of time on this one because we already talked about it. Homeless people don't have jobs. Again, let's bust that one. Across the state as a whole, in any population of homelessness, 20 to 40% of those folks have a job. You put them in a homeless shelter, about 53 to 60% of them have a job. It's really just the transient nature of homelessness that often contributes to not having a job, especially if you don't have a car. So if you don't have a place to stay, you don't have an address, sometimes it's hard to get an ID, you don't have a computer to print out a resume, all of those other factors are what's contributing to not having a job. So you put them in a shelter, and in a shelter that provides case management and support services, and all of those little parts go away, they get jobs. At Seacoast Family Promise, anywhere from 70 to 80% of our households are employed, either at entry or by exit of the shelter. And the 20% that are not, more often than not, are people who are on disability and on fixed incomes. So there's just a handful that are not employed when they're with us. And then lastly, that homeless people are dangerous. And this is very much a perception that's portrayed in media and in film and movies, that if you see a homeless person, they're likely under the influence of a substance, and that they're dangerous and they're going to hurt you. This is absolutely not the case. It's actually the opposite. We see that folks that are experiencing homelessness, especially elderly individuals, those that are chronically homeless or have mental illness, are actually the recipient of crime more than they are causing any issues. Furthermore, there's a huge fear to report any crime that's occurred when it comes to homeless population, because they're already looked at through a very, very small lens. The kicker to this, I will say, is unfortunately we're going to see a huge uptick in crime amongst homeless individuals, because the act of being homeless is being criminalized in many states and in many communities. It's happened in Manchester, so those encampments that were in public properties, if you were in one of those campgrounds, you were committing a crime. And our current legislation, again, has encouraged folks to imprison them or send them to treatment facilities. Treatment facilities is great when there are available beds, and it's needed. However, being homeless and experiencing homelessness itself is not a crime in any statute by the matter. And unfortunately, it is becoming criminalized more and more. So I do think that we're going to see a change in this, but it's not an accurate change. So don't believe it. Before I talk about Michael, any other common misconceptions or questions? Yes, go ahead. Or, yeah. Thank you, Judy.
I'm curious about, you mentioned the families that bounce between beach rentals and campgrounds. If those families have school-aged children, where are those kids going to school, and how's that
So,
working out?
there's a federal law called McKinney-Vento, and that states that any child who becomes displaced or homeless during a school year has the legal right to continue to go to school in the district that they were in, that they became homeless in, or they can transfer to the district that they're temporarily staying in. And above and beyond that, the receiving school, so if they move, and the home school where they started, have to cover the cost of transportation to ensure that they get to and from school. So every child experiencing homelessness fits into this category. There's also some other resources for food and other things that come into play too, but the biggest one is that they have the right to choose where they want to go to school, so then they're not having to move from district to district during their experience of homelessness. Yes.
I debated whether to admit this or not, but I've lived in both states, Maine and New Hampshire.
Yep.
And the reason why I moved to Maine was I could get more help. I have,
Absolutely.
in the past 25 years or more, I have experienced homelessness, job loss, illness, my kids having to move on
Yep.
because they attained a certain age.
Yep.
I have lived in dumps sponsored by the YWCA that you wouldn't want to put your best friend in or your worst enemy. I've experienced, the only thing I haven't experienced has been crime.
Sure.
And this is tearing me up.
Oh, I'm so sorry. But thank you so much for sharing that. I appreciate that, the vulnerability of you sharing that information. Unfortunately, it's true. In the state of New Hampshire, yes, the paperwork, yes. That's probably the number one thing that we hear is, I can't do this anymore. They ask me to talk about it every single time I step into the room, and then I have to fill out the same damn paperwork. Yes. So I totally hear you. And it's a awful necessity, and I'm sorry that you've had to battle that alone, it sounds like, in a lot of times in your life. And in the state of Maine, you are right. There's a lot more going on right now. And they've got housing figured out a little bit better. The way just a little bit, but a little bit. They've got a few more resources when it comes to case management and housing. They break it up very differently. It's broken up by county in the state of Maine, whereas in New Hampshire, it's run and managed by each town independently. So the funding discrepancies is wild. The number of housing choice vouchers, so the money that goes towards housing to help you afford. Awesome. That's split up by towns in the state of New Hampshire. So big towns get a lot, little towns don't. But in Maine, they break it up by county, which helps significantly address that a little bit different. But live free or die. Thank you so much for sharing. Any other questions or misconceptions that you would like to share or have a question about? Yeah. Oh, she's got a mic for you.
I just wondered for families that are in tents or something like that, you said that they had to go off of some properties. Where do they go then?
Unfortunately, they are, moving to other towns is what we're seeing. They're moving up into like the North Country a lot more, so I'm getting a lot more calls from Laconia and Coos County because they've moved because there's less foot traffic, so it's not as visually seen. And then they're going to welfare and asking for help, but they're being turned away pretty rapidly. And then unfortunately, they're going to jail. That's also happening. We're seeing folks get arrested for being in those encampments. I do feel fortunate that we have a lot of really incredible police that are a little bit more understanding of this issue. They attend a lot of the same meetings that I attend, which is really encouraging. Dover has an incredible social worker that's been going to other offices and talking about the importance of social work and police stations. And anyway, they're still getting arrested, though, just for being homeless. So it's not something we want to see, but it is happening. And then the beds are all full at emergency shelters. There's very few nights of the year where there's one single bed available in the state of New Hampshire, just because there's so many people experiencing homelessness. Yep. So they're still there. They're just in different places more often than not. Yeah. Go ahead.
I just would like to get your advice. I feel like all of us, I think, about these people. So I have some dollars in my car, and so I try to give, and sometimes there are people that are just desperate in the street, and they say, and I get a little scared. Sure. So I wonder which way is best to help these people.
Sure, that's a great question. So everything that I'm saying, some of these misconceptions are true for a few individuals, and there are some instances where it is a little scary. And we're not going to discredit that, of course, either. When we talk about families, it's very different. More often than not, none of this applies. In my 10 years of working in homelessness and housing, I think I have met one family, and I've worked with more than 300 families, who was kind of speaking some of these mistruths into existence. So one, and even then, we'll see. So in those situations, it can be scary and intimidating, and sometimes there is a lot of mental health issues going on that they're experiencing, so they're unable to gain access to resources and tools, and that seems to be the only solution for them, is to stand out on the road and ask for money. What I would say, if you feel inclined to support somebody who is having that experience, rather than doing it in cash, exchange it for a McDonald's gift card or a Wendy's gift card or a grocery store gift card, because then it's addressing the need that they're asking for. Because more often than not, they're saying, I can't afford food, I can't do anything. You're giving them that solution without handing them a piece of food, which sometimes feels a little, and they may not be comfortable receiving it. I used to keep water bottles in my car too, for that exact reason. I'd rather somebody be hydrated and safe. But exchanging those dollar bills, $4 at a restaurant or at another place, is a good tool to switch to. It ensures that they're doing something safe with the money you're giving them. And also, it's still a tangible help in that situation. I would not recommend saying, here's some resources, go do this, because they may say, well, screw you, lady, I don't want your help, I just want your money. And that's an intimidating and scary thing. So that's what I would recommend. Same thing, unopened bottles of water, those sort of things, if you still feel inclined to do that. I will also say, do not ever feel that you must be the person that is doing that, though. There are still outreach folks that are physically doing that for these communities of individuals as well. There's a few organizations in New Hampshire that go to all of the tented communities, and they hand out toiletries and gift cards for coffee and Dunkin' Donuts and water, so many things, clothes. They hand those out to those folks too. So they are getting resources, even if they're that person that's out on the street asking for it. But I would encourage you not to engage too much for those safety reasons. And if you feel inclined, rather than it being cash, do a gift card instead. You're welcome. All right, let's quickly talk about Michael. So Michael, this is one of our families, and those are two of his children, two of his lovely, lovely sons. Michael came to us right around COVID. His wife had died of cancer, and he was now a single parent of 3 children, one teenager and these 2 young, precious boys. And he could no longer afford rent on a single household income. He had been living in the same unit with his wife and his family for 6 years. And because they lost one income, they could no longer afford it. He fell behind on rent. The apartment complex tried to work with him. Then he fell behind on utilities. Everything just kept happening. And he was trying to go to a shelter, but he had a teenage daughter and he had 2 sons and nothing was really fitting. Fortunately, we had a space available and Michael came to Seacoast Family Promise. During their time with us, we learned that there was so much more going on emotionally with these sweet, sweet children. They had lost their mom very traumatically, very suddenly, and we're still grappling with that. They were both struggling immensely in school because of it. So we were fortunately able to give them the resources and tools to get therapy, one-on-one counseling in school as well. And then Michael, really just the time to talk. This guy needed to talk about what had happened and what his experiences was and where he was struggling and what he needed. And during their time with us, not pictured, his oldest daughter, April, actually applied to college and got into Plymouth State. And we were able to help her with our family fund and with applying for scholarships, get her to college. So she moved out and she moved to college and had a wonderful time. And Michael was able to secure public housing. So it's a fixed income housing, and moved to that, which was in the nick of time because he had a heart attack not long after moving out. So he immediately became unemployed when he moved out. So going from full-time employment, stable housing, with a housing trust voucher, to a heart attack and unemployed, he was able to remain stably housed through it all. And now, what is that? 5, 6, 7, 8 years? 2018. So 8 years later, he is still stably housed in his apartment with his 2 boys. And his daughter took a little break with the school and kind of spread it out a little bit. But she's in her senior year right now at Plymouth State, and she's doing incredible. She befriended new people. I also want to mention too, his daughter was not his biological daughter, so he adopted her when mom died. Which is also incredible. And then some of the crazy things that we had to do is his son Gabriel, the one with the leaves on his head, he didn't have a social security card when they came to us. He was born outside of the country because his mom was from the Philippines. And so he never got a social security card. So he never received any death benefits in the household for the mom. So that further exacerbated their financial hardship. So we helped them get a social security card, which without the mother who had this child was really difficult, but fortunately we were able to do this. And like I said, Michael has remained stable for just about 8 years now with his children, which is incredible. And they come and visit, and the little one is on the jump rope team, which is so much fun, and he absolutely loves it. All right, so to kind of wrap us up a little bit, we're just going to have some discussion and reflection. So I'd like to ask you all, what is something that surprised you most about what we talked about today? Anybody? Or any of these 3 things. What surprised you most? How do these realities differ from common perceptions that we might have? Or what challenges might families in our community that you know might be facing? Anything, anybody?
And that they are resting. I know I was in Denver, Colorado, and
Yes.
it was known to be illegal there.
Yep.
Homelessness, and this was when I was in seminary, 2000 something, and I knew it was like everything people did who are homeless, living, going, using.
Yep.
Anything that is human,
Yeah.
eating, is illegal. And the other piece was having an address. Which
Yeah.
And I was actually wondering if there are creativity, like if people are thinking of new ways
Yep.
of serving people. Those
Yep.
are just a couple things.
So if you're in a shelter, you get to use their address, first and foremost. There are also a couple organizations in the state that allow you to use their facility as your home address to solve that problem. There are not a lot of them. St. Vincent de Paul sometimes resources folks to be able to gain an address so that they can register their car so they can go to work, like very basic things that we take for granted. There are very few, but there are resources and tools to do those sort of things. The other thing she mentioned was just living in Colorado, seeing homelessness out there and how it was so criminalized, and just talking about how we wouldn't expect it in New Hampshire, but it is the case, and it's becoming the case more often, so, which is heartbreaking. Anything else? I know I want to give you guys your time back for the day, too.
What are your sources of income?
For families, or ours in the shelter, the agency. So right now we do not receive any state or federal funding. During COVID-19, we qualified for funding from the state of New Hampshire because there were some minor adjustments to the qualifications. Because we are a family shelter exclusively, one, and because we require case management as a part of the programming in our facility, and three, we require people have a vehicle, we do not qualify as a low barrier emergency shelter. So that means we don't apply for federal funding, and that means we do not apply for a lot of state funding. There are ways around that because we are in a rural area. The car thing becomes a little less of a concern when it comes to low barriers because there frankly is no transportation. So if you have two buildings, they're a little bit more okay and a little bit more lenient with saying, I get why you guys require the vehicle. But because we require case management, HUD's definition of a low barrier shelter, one of the first things is that you cannot require it for them while they're in the shelter. You can offer it and let them know it exists, but you cannot require it. We feel very strongly that it's one of our driving forces and our successors in the program, and why we have an 80 to 90% success rate in families moving and staying in stable housing is because of that case management. So we do require it, but because of those things, we don't qualify for state and federal right now. Most of it is grants. Grants, we do a small amount of fundraising, and individual donors. We have a very, very kind community, and our individual donors and foundations really support us significantly.
I wasn't surprised, in terms of the cost of living and how it impacts homelessness, but I think it was both sad and good to see the actual numbers.
Yeah, sure. I know sometimes it's like conceptually we know it's the case because we hear about it and we talk about it with our peers. But then like pen and paper, seeing those numbers, I agree. It's jarring sometimes, especially in Rockingham County. Yes.
If we could help as a church, what would be the most important thing to give money to?
Yeah, of course. So this group has blessed us unbelievably with the grant that you guys gave us earlier this year, which went directly to our Family in Need Fund. And that is one of our biggest needs, but also just general operations, of course. We are nearing, very, very, very closely nearing the completion of our construction project, which will allow us to go from housing 4 families at a time to 10, which will in turn, we'll be able to have about 40 individuals if we're at a full capacity in that building. With that, utilities. Utilities, the expense of running that building, and also the cost of day-to-day living for all of these individuals is going to quadruple for us. So anything that's for program-related funds, and in this case, the grant that you guys so kindly gifted us went to our Family in Need Fund. That helps us support our families long-term and moving. So families like Michael, families like this lovely mother here, Elizabeth, when they are behind on a rent payment because they were sick, they can apply for financial assistance from us to be able to cover that cost. Last week with the funds, we actually helped a family that is near and dear to my heart. I will admit that. They actually had one of their children who was in an accident earlier this year and was in the hospital. And because of that, they of course, there was nobody working because they were driving back and forth to Boston, taking care of this child in critical condition. She has 8 other children at home. So finding childcare while she was trying to take care of her daughter was just unbelievable. So understandably, they got behind on bills, and one of their bills recently was a utility bill and a plumbing bill. And we were able to cover that cost. So now they do not owe any back utilities, and we're able to pay their rent and stay stably housed. So family in need, direct family funds, and programming is what we look for primarily. And then above and beyond that, laundry soap, cleaning supplies, those sort of things, because we go through that 4 times what you do in your home, because we have 4 families in the house right now. So laundry, cleaning supplies, toilet paper, paper towels, all those basic needs that we all have, we use it constantly, and we also try to provide it for families who need it. So if any of our aftercare families, folks that have moved into stable housing, who are just skating by financially, you can't always get laundry soap and toilet paper at food pantries. There's a couple that you can, but you can only go like once a month. Sometimes that is an unachievable thing for them to afford, so they could come to us and say, I really need toilet paper this month, Ashley, can you help me? And because of donations from our community, we can say yes. So those are the biggest things. And then lastly, I would say gas and grocery gift cards. As many of you may have heard, food stamps are stopping because of the shutdown right now. So all of our folks who receive SNAP benefits will not be getting their SNAP benefits imminently, and unfortunately, what may be accessible in Manchester and Concord is not the case around here. And there's an incredible amount of food pantries, and we partner with them religiously, but there's still milk, and there's still meat, and there's still toilet paper and paper towels, so gas and grocery gift cards is critical to us to be able to support those folks right now.
So to add on to the SNAP benefits being cut, if you are recertifying in this period right now, you will be refused. So if you're existing and you're recertifying, they'll cut you off. And if you're new, they're not accepting new applications right now. They may be processing them, but it's with no funding, then it's chances are very poor of putting new people on the program right now.
And we're partnering with, the state of New Hampshire is partnering with the New Hampshire Food Bank, of course, and Kelly just spoke about this too. However, that only goes so far because some of their federal funding comes from all of that as well. So unless the community rallies around food pantries and organizations like ourselves, that's also going to run out because we don't know how long this is going to take, and the number of families on food stamps is astronomical right now. Anything else before we wrap it up? No? Awesome. So thank you so very much for coming today, and I'll be back in 2 weeks, and we will continue this. And in 2 weeks, we're going to talk about what some of those challenges are that we can address, and understanding what best practices are. So a little bit what we talked about with interacting with folks, we're going to talk about that more, and how you can better serve these individuals in your community, how we serve them, what those best practices are. And then also we're going to talk about resources and tools in our community so that you guys can know better how to help families that are experiencing homelessness as well. That is all. Thank you so much.
Thank you, Ashley. And for those of you that do want to contribute with diapers, cleaning supplies, laundry detergent, you can bring them to church next week and definitely the week after when Ashley is there. And I can run them over as we get them.
Thank you. Thank you all. I appreciate it. Have a lovely afternoon.